So I want to get started and get right to it. And I'm going to ask Jenny to go first and then Natasha. Just tell us a little bit about yourself, kind of where you're from, kind of what your interests are, and if you can also share with us your diagnosis of metastatic breast cancer and what that journey was like when you were diagnosed, your breast cancer subtype, and your current treatment regimen. Thank you so much.
Thanks, Celeste. Welcome, everybody. My name is Jenny Burkholder, and it's an honor to be here. My interests at this, well, I guess I'll start in a different place. I was diagnosed with early stage breast cancer in 2012 when I just turned 40. And so I did all of the standard of care. And then at the end of, in the middle of 2019, 7 years later, I thought I had an injury in my sternum, and it was incredibly painful. So for 3 months, I couldn't figure out what I had done. I thought I had hurt myself in a yoga class. So finally, I went to my oncologist, and we both sort of speculated that it was an injury. But, you know, because I had had breast cancer in 2012, it was important to do a CT scan. And what had happened, so what we were looking at was metastatic breast cancer that was in my sternum and spine and hip pelvis area. So that was December 31st of 2019. That was my New Year's Eve gift. So from there, I retired from a teaching job that I had had for 16 years, and now am doing what I love to do, which is writing a lot. And I dance, and I try to keep myself healthy. And I'm on my second line of treatment. So my first line, because I'm triple positive, I'm on my second line of treatment. After Herceptin, I'm now on Enhertu, which I do at this point every 5 weeks. And, you know, Enhertu seems to be doing its job at this point. So I'm very excited about that. We have 2 children, so I spend a lot of time, you know, trying to be present for them. And again, you know, at this point, I have the opportunity to dive into what I love to do, which again is writing, dancing. I teach yoga, volunteer for LBBC, and try to, you know, spread the word about living with metastatic breast cancer.
Thank you so much. Very much having a full round of experience, and thank you for sharing your journey with us. Natasha, can you go next and tell us about yourself and your journey with metastatic breast cancer?
Yes, thank you. I'm Natasha McIntosh, and I'm from a little town called Lawndale in North Carolina. I was originally diagnosed with breast cancer at the age of 42 in 2015. I was diagnosed with ER/PR positive, HER2 negative. I went through chemo and radiation, and I had a bilateral mastectomy. I know I made it through my 5 years, and in 2021, I received my metastatic breast cancer diagnosis. I was working as a child protective services social worker, and I noticed that my left hip just started hurting all the time. I was going back and forth to the doctor. They were telling me I had sciatica. I had physical therapy, you know, taking pain medications, and nothing helped. And so finally, I just went to my oncologist, and I was like, something's going on. We need to do some scans. And so when they did the scans, it came back that I did have mets in my bones. So my breast cancer had metastasized. I had radiation, high doses of radiation, and now I'm on Ibrance and anastrozole, and that's still my first line of treatment. And so far, things are still stable. I enjoy traveling, eating good food, and spending time with my grandchildren. I have 3 adult children, so they pretty much do things on their own. So my spare time is spent with my grandchildren and going to the zoo, and I try to do amusement parks and stuff like that when I can, but I am limited sometimes due to the issues with my hip and my walking. So right now I'm not working because of my medical issues, but I have been trying to substitute teach some on the side.
Oh, thank you so much for sharing your journey. There's some similarities between
Mhm.
both of your journeys with your initial diagnosis coming in your early 40s and then having some types of concern or symptoms and then going to your oncologist and then your oncologist doing further studies and that leading to your diagnosis. So
Yes.
I think it sounds like that experience says go to your oncologist if something is not off, kind of talk about what's going on with your body and that you both had signs in your body that led you to seek further treatment for sure.
Mhm.
So I want to ask a little bit more of a deeper dive, and Natasha, maybe we can start with you this time. What was your emotional experience when you first were, had this metastatic diagnosis and kind of what were your feelings? What were your coping strategies? How did you kind of talk to your family and friends?
Well, at first I was shocked because with my initial diagnosis, everybody would always tell me, even my doctor, if you make it to your 5-year mark, you're out of the woods. So I had made it to my 5 years and I was like, oh, okay, this is all behind me. I'm going to just move on. So when I got the diagnosis, it just kind of blew me away. I was kind of scared because I really didn't know a lot about metastatic breast cancer. I've, talked to different people who had metastatic breast cancer at the time, but I just really didn't understand it because I just felt like it didn't really pertain to me. So I didn't really dive deep into it. And as far as my family and friends, I kind of kept it from them for a little while because I didn't know how they were going to react to it. I didn't really want to put that on them because it was right at the holidays. And a lot of times when people hear metastatic, the first thing they think of is death. And I didn't
Mhm.
want to ruin everybody's holiday. So I carried that burden on my own for about a month before I shared it with friends and family. But once I did tell them, everybody was very receptive, and they just dove right in there. I had a great support system. Everybody was willing to do whatever they could to help me get through it. And as far
Um,
as my emotional side, after I processed it, I understood that, I made it through the first time and it's all a mental thing. I just had to get my mind in the right space to know that I just had to make decisions that I felt were good for me. And once I did that, I think things started coming together for me.
mhm, mhm. It's so important. Jenny, is anything that Natasha said resonate with kind of your experience as well in terms of how you initially coped and your support system? If you can share a little bit what your journey was like.
Yeah, a lot of Natasha's journey resonates with me. At first, I was actually really relieved that I found out why I was in so much pain. Like 3 months of trying to search for an answer was maddening. Was maddening. I couldn't figure out what was wrong with me. And there was a certain like, oh, okay. Now these putting the pieces together makes sense. And then, of course, there was the fear. I was initially, when I was diagnosed in 2012, I was HER2, I was ER/PR positive and HER2 negative. But the second time around, I was ER/PR positive and HER2 positive. And, according to one oncologist, I was wildly HER2 positive. And so it was sort of, that would explain why it was showing up everywhere. So that was terrifying because, now what? In my bones, of course, but that was terrifying. And then, yes, the hard part is, putting the phone down with your oncologist and then turning to your partner, your friends, your family, all of those women who at least in my case, have been talking to on the helpline, who are so afraid of recurrence, right? And saying, oh my gosh, I am that person. I have had a recurrence. And so that was also really challenging. And to my kids, like, how do you explain what metastasis is? And I echo what Natasha says, right? You say that you've got metastatic breast cancer, and people are like, are you, like, see you, like goodbye, like it's not like that. But, there's that certain, like, the face changes, right? The how people look at you changes. And that can be really hard. especially when you're wanting to feel sort of empowered and autonomous.
Mm-hmm.
So there was, yes, but then I also have an amazing support system. I live right outside of Philadelphia, so LBBC is not only not only local people, but to me, for me, a local organization, and the same people who were in my corner the first time, my husband, my kids, my mom and dad at that point, my sisters, my friends, my colleagues, all were like, okay, what do we do? And just like Natasha, it's like, you got to get it together. And figure out what the next steps are. And and that is not easy. There were a lot of difficult choices to make.
Yeah, for sure. And one question I kind of want to ask both of you, kind of a spin on that first question, how did you cope with or manage the emotions of your loved ones as you were telling them? Like, did you have, because sometimes we hear from patients that's kind of an additional source of stress and worry. How am I going to manage the emotions of other people? So kind of how did you approach that very challenging conversation and dealing with, looking in the eyes of your loved ones and dealing with their fears? Like, kind of how did you deal with that as well? Either one of you can answer.
Well, I just reassured them, that everything was going to be okay, because I just felt like if they felt that I was okay with everything, that they would be okay. So I just found myself always supporting and taking care of them more so, and telling them, so that they would be okay with my decisions and not be afraid for me going through what I was going through. And so I found myself being more of a counselor support system for them, with me telling them about my metastatic diagnosis.
Yeah, I think part of me kept it really simple, even though it's incredibly complex. Is that, this is what's happened. This is where we are. This is, what I don't know what's going to happen next, and try to stay present. Certainly, some people, it's harder to tell some people than others. And yeah, I think doing my own, finding my own way to manage my own anxiety was really helpful, to be able to speak to somebody else, not knowing how they may react. So I had to find ways to help myself before I could, speak about it to other people. And, there are still some people that don't know, like, certainly in the sort of like my core group, but sometimes people are surprised, and when I say, oh, I live with metastatic breast cancer. And so that also became a choice that I made, who to tell and when to tell, and why I would be telling them, and how. So
that's so important. And that's kind of that piece of empowerment too, and kind of telling your own story about who you tell, what you tell them, how much information you share, and how are you communicating that information. And I want to reflect back what I heard, a couple of the emotions that we've mentioned so far. We've mentioned shock, we've mentioned fear, we've mentioned anxiety. Are there other emotional experiences that maybe have changed over time? Other things that we can add to the kind of dictionary or a range of emotional experiences that you've had, and any kind of coping strategies that you have employed to help manage those emotions or identify them in the first place? And Jenny, I'll start with you this time.
I think the hardest one, and now I'm not going to be able to say this without crying. I think the hardest one is sadness, right? So the hardest one is when you start to look into the future and whether or not, I'll be here. So that's really, especially for my kids and my husband and my family, you know, that's hard to think about. So for me, I spend a lot of time, I employ, somatic, like I'm dance, I have to move my body. I practice yoga. I practice mindfulness. Like I have to move. That's me. I have to move because it has to move around. Like the sadness needs to like move around and like I need to release it. And, so for me, that's really important. Yeah, I think over time, the fear, I get more and more sort of, I don't know what the word is. I don't reassured maybe by treatment options. Like, there's a certain, like, I feel a little bit reassured by the number of treatment options. So that there's something that has shifted and I don't feel that same fear. And I think the sadness is always going to be there and I have to manage it. And then, I've really realized in the last since 2019, that joy is so important, right? It's important to have in my heart and it's important to share and to be part of. So that also has shifted. And, so there are a lot of lessons that having metastatic breast cancer has really taught me. And one of them is to really bring my joyful presence as much as I can, so.
Absolutely. Natasha?
Yes, to piggyback off of Jenny, I will say sadness is one that really hit home, it's always there. It's always present. Just because of the unknown, the what ifs. But I found that through meditation, mindfulness, and just relaxation methods have really helped me find my happy place. For the longest time, I didn't have a voice. I would just keep things all bottled up inside. And I've learned that I need to express myself, and expressing myself helps me deal with things in a different manner. I would say now that I was really, really afraid in the beginning because I didn't know what to expect or how things were going to turn out. But I've met some beautiful people along my journey, in different support groups, just attending different retreats, that now I feel more empowered. I kind of understand what's going on with me and, different treatment options. I know the questions to ask my doctor when I go to the doctor, and I'm not just that patient sitting there in the chair listening to them tell me what I need to do. And as far as me being more empowered, it's given me more life. I live every day, as a new day, and I live that day to its fullest. I do things that I enjoy. I'll book a trip and go on a trip, just because I want to. If I want to lay in bed all day, I lay in bed all day. I do
Mhm.
I do what I feel like I want to do now instead of doing what others expect me to do. And that has really changed things for me.
Wonderful. I want to come back to kind of the similarities and some of what you both have shared. Um, Kind of the practice of being present, being mindful, as coping strategies, but also it sounds like as ways to be in the moment and live each moment to the fullest. It sounds like both of you have had an experience of learning or taking from this particularly difficult, sad, all of the things that you've talked about, scary, anxiety provoking, sad, but also finding the joy in the moment, in the presence, in making each day the best day that you can. And that's also been kind of like a paradoxical appreciation, and awareness of that. Um, yeah, go ahead.
Celeste, sorry to interrupt, but we have an audience question I wondered if I might
Great.
pose because it ties to some of the things that have been said recently. So
Excellent.
I'm just going to read this. Sorry, I have to look at a different screen to do that. So I think this would be a question for Natasha and Jenny. So maybe Natasha, we can have you start with this,
Okay.
whatever you'd like to share. How do you deal with feeling well, looking well to the outside world and wanting to live normally not always bringing up that you have MBC, but at the same time, reminding people sometimes that you do have MBC and you want boundaries respected, like not taking over too much stress, etc. So a kind of a balance there.
And it definitely is a balance. And I'll just put this out there. I was at a grocery store one day last week, and I ran into an old friend from school, and we just had a casual conversation. And at the end of the conversation, she looked at me and she says, "Well, for someone who's so sickly, you sure look good." And I thought, now, if that's supposed to be a compliment, it wasn't. So I just looked at her and I smiled and I said, "Well, you look good, you feel better." But I just live, I do what I can. And if people expect more from me, I just tell them, I'm tired. I can't do this today. And, I do have health issues. It's just a given. I'm not able to do the things that I did in the past, though I may go out and have my hair done and look nice. I still may feel bad. But I just find myself pushing through, and I know my limits. And if I can't do something, I'd let someone know that I can't do it.
Thanks. How about you, Jenny?
Very similar. I mean, like I'm on, because my treatment is every 5 weeks, I have this opportunity to feel really good. And for example, I'm back for treatment on Monday. And so there's always this reminder that I'm in treatment for the rest of my life. And so there's that. And then there's also the week that I won't feel good. And it's actually, again, it's sort of helpful to remember that I won't feel good, because when I do feel good, I feel even better. But I think Natasha, yes, right? There's only so much we can do. And there's only so many times we can show up. And, saying no is now part of my vocabulary. No, thank you. No, thank you. And that's about me. That's not about you. That's about like, I can't do something or don't want to do it because of energy expenditure. So that's also been a lesson that I've learned. And I also know that when I feel bad, I really feel bad. And like that also, reminds me that, yeah, I'm not well, I guess, 100%. And yet, I often don't think of myself as sick. So it's a very strange way to live your life, but it is what my life is. So, yeah.
And it's what works.
Exactly.
Stephanie, do we have any other questions right now before we segue?
I think go ahead for now, and I'll share any others that might come in later. Thank you.
Great. That was a wonderful question.
It really was.
Which leads me to kind of how do you both manage boundaries in relationships in your life? Well, not just boundaries, but how things may have changed since your diagnosis, how you may interact with loved ones, friends, coworkers, people that you run into at the supermarket. How do you think relationships have changed for you since your diagnosis? Let's start with you, Jenny, this time.
I just want to say the whole moment in the supermarket is a thing, because it is like, it is all, you run into somebody and then suddenly, they want to tell you things about you, and, in the like gluten-free aisle, suddenly you're having these conversations. That's where you need to be most aware. Relationships have changed. I think, everybody in my immediate circle is very keen and mindful of where I am. Sometimes I have to remind them, but I think, again, like I said, I think being able to say no has been helpful. And I'll just echo what Natasha said. It's really, the choices that I make are about my time and energy and heart. And so I think part of that is also age. I'm as I've gotten older, I feel more confident doing that. And then of course for my husband and my children, like I'm able now to prioritize my time in a way. So if that has affected some relationships, I'm sure it has, definitely, I'm sure. But for the most part, my relationships, from the very beginning, or actually, I think after my initial diagnosis and sort of coming out of that, I think that's when I did the work around relationships and really, making sure I was in relationship with people that I wanted to be in. Right. So I think actually after the initial diagnosis, I did much of that work, and people sort of, there were people who were no longer part of my circle after that. But that was when I really shifted. So I feel like when I was diagnosed with NETs, it was like a whole, people were there. But yeah, I think that's an important piece is figuring out who's supporting you and who's not, figuring out who's with you and who's really not with you, and that sometimes those sometimes those are painful conversations to have, but they have to happen.
Mm-hmm. Yeah. Natasha?
Yes, I've truly been blessed when it comes to relationships. My longtime friends and my close family members, they respect my boundaries. Um, if I don't answer the telephone, there's no question. I don't want to be bothered, or either I'm tired. Um, I'm a wimp now. I go to bed really, really early. So I turn my ringer off and I wake up in the mornings and I have all these calls and I'm like, I'm in the bed by 8:30, so you need to catch me during the day. But everybody understands if they want to make plans, they'll call me, they'll ask me, what's good for you? How are you feeling? When would you like to go? So they pretty much tailor things around me and my schedule and when I can join. And for those who can't, I'm just not going to be a part of it because I'm not going to push myself to a limit that I make myself sick or make myself feel bad. So that's just a part of my life. And like Jenny said, I've learned to say no. And when I say no, that's the end of it.
Mm-hmm. Have either of you ever had to, deal with kind of frustration or kind of revisiting conversations with maybe not your immediate circle, but I'm kind of thinking about the people who may be watching who may have had experiences where, they were frustrated or disappointed from relationships in their life, wanting, kind of asking for support and not getting it, or asking for boundaries to be respected and not asking for people to kind of acknowledge that, yes, I might look well, but I also am undergoing ongoing treatment and I'm going to have days where I might not feel well or I feel ill. Have either of you had that experience? And if you have not, can you maybe speak to folks who may have had that experience and some suggestions about how to handle it?
Well, I will say when I was initially diagnosed in 2015, I was in a relationship. Things were really good, until I received my metastatic diagnosis. And I could kind of see, that the tables had kind of shifted, kind of withdrawn. And that's fine because everybody can't handle everything. I understand that. But at the same time, if you can't handle it, don't expect me to try to figure it out for you, because I have my own things that I have to deal with. So we can agree that if this isn't for you, then it's not for me. So after 6 years, our relationship was ended because of someone not being able to handle what I was going through and understand how to handle their own emotions.
Mm-hmm. Wow, thank you for sharing that. And I'm sure there's some folks in there who can certainly relate watching this video. Jenny?
Yeah. Thank you, Natasha, for sharing that. That's such an important noticing and Natasha, that's it. You're right. It's like we have our own, and as I guess as an adult, I expect other adults to be able to do their own work around their emotions, and not everybody can. And that's not mine to carry. It's not my burden. It's they have to figure that out. And again, these can be hard conversations to have with somebody, but important ones. And not only just for my own self-preservation, right, but also for them, like, to encourage them to be more human, and to be more human means, to show up in ways that are for other people. And so,
Yes.
that's also, so yeah, there could be a lot of sadness and pain around that too, but I don't know. Ultimately, I like to think that it's helpful for both parties.
Right.
Mm-hmm. Mm-hmm. And that honesty, right?
Right.
And kind of knowing yourself and having those difficult conversations. Yeah. Go ahead, Stephanie.
Thank you. We have another question from an audience member. Some really thoughtful questions are coming in, and I felt like this one may also have a tie-in. If either Jenny or Natasha would like to answer this one. How do you deal with your own parents' feelings and fears around life expectancy?
Well, luckily for me, my parents are so oblivious. They feel like I'm cured because I did radiation and I'm on medicine. And no matter how much I try to explain to them that I'm not cured, that it can always metastasize somewhere else, they just don't understand it. All they see is their little girl just going through life and having a little hurdle that she overcame. And I'm glad that they see it that way, because a lot of my anxiety came from worrying about my parents. Because, in life, we look at it, a parent is not supposed to bury their child. And so I don't want that for my parents. So I coddle them a lot. And a lot of things I keep from them simply because I know that it would just devastate them, because my parents are a lot older. So for me, that's how I deal with it, because I let them stay in their happy place. And if there's something that I need to share with them, I share the least bit that I can.
Mm-hmm. Mm-hmm. Mm-hmm.
Thank you.
Thank you. Yeah. And everybody's strategy is different on how they handle that, and your relationships best, for sure.
This is a difficult question for me. My father died of COVID in 2020. So, and so often, so my mother, I have two older sisters. So I think my mother and my sisters and I have become closer. But yeah, I think I don't know if I think my mom would believe whatever she wants to believe, regardless of what I tell her. And I think I'm like that as a mom too, like, so I appreciate her support. And, I'm not going to get into the language I'm not going to get into again, I keep it simple. This is what, she needs to know. And she doesn't need to know the whole process. She's not interested in the process. She's interested in, the outcomes. And so, yes, if this is the outcome, this is the outcome, and I think if I were in the position with a child, I think I'd like that too. Like, I have to deal with the process, and I have a sister who's very involved in the process, and we can talk, cells, and we can talk treatments, and that is all great. I don't need to share that with my mother. So, and they will, my mom and my sisters will always show up for me, so that's also really important, in their ways that they know how, so that's, that, but yeah, I think there is something to keeping it simple, even though it's incredibly complex. And I have other people, and that's the other thing I've learned, especially as an adult, right? I have other people that I can process the complexity with. I don't have to do that with at least in my world, I don't have to do that with my mother.
Right. That makes sense. That makes a lot of sense. Stephanie, do we have any other questions on this topic?
No, not right now. Thank you.
Okay, great. So this is a good segue into, you touched on it a little bit earlier, but kind of the different places in which you seek and find support and a sense of community, and kind of also thinking through what your experience has been and kind of suggestions for people who are watching about different places they may be able to seek and find support and a sense of community. Natasha, let's go with you.
Okay. I'm in a very rural area, so we don't have any type of support groups or anything locally. I would have to travel at least an hour and a half to a major city to meet with a support group in Charlotte. So I found that I've met a lot of ladies at different retreats that I've attended, ladies that I've met at different conferences, and they have been a blessing. We've connected. If I have a question, I can reach out and call someone, or we can just sit and have a casual conversation about different things. There are several Facebook groups that I've become a part of, and we just have monthly or weekly meetings, and people bring their questions to the table, and you just discuss different things with one another. And it's made a big difference for me, because when I was first diagnosed, I didn't have anywhere to turn to because there was nothing here in my area.
Mm-hmm, mm-hmm. That importance of that online connection, which we've learned a lot more through these last 3 years. I know there were certainly online forums and things like that before, but I think it's opened a lot of people's eyes, and I'm so happy. And I'm glad you brought up that people live in so many different areas, urban, rural, suburban, and why it's important to try to, look and seek support, and maybe you have to do a little bit more digging, but it's there. For sure. Jenny, if you want to talk about where you sought and found support.
Well, LBBC has been my rock since 2013, basically, when I was introduced to the organization. And I have been a helpline volunteer, and that was really unbelievably helpful for me. One, because I had to be present for somebody else. And two, I had to learn a lot about myself in order to do so. So being trained as a helpline volunteer and then being one for many years was really powerful. I too am part of some closed Facebook groups. I am not somebody who seeks out support groups. It's just not my personality type. Though I do love the closed Facebook groups, because I've both posted on them, though not very often. But I love seeking the knowledge that is found there, especially, for example, Infertu has its own closed Facebook group, so I can learn a lot about that. But then I also became a Hear My Voice advocate. Again, I like the idea of sort of training me and then using the training that LBBC has given me in order to then make connections with other women, and then to really sort of find that outward expression of my inward suffering, and like advocacy has been really helpful for that. I also do a lot of writing. I keep a blog, OVERexpressed, because I'm overexpressed in my HER2 positive. Yeah. So I keep a blog, so that's helpful. And I've met some interesting people through that, who read it and then, correspond with me. So those are the ways in which LBBC's really served me. I mean, in so many ways. And like, Natasha, the online is great. And I'm glad that we're here for this conference this week, because we can all be present with each other, right? So, I happen to have the advantage of only living 10-15 minutes from the hotel, but, Natasha has to come up on a plane, and a lot of people are coming via different modes of transportation, but that we have this opportunity, not only virtually, but then in person, to make these types of connections. And I bet there'll be many more, ways in which people are interacting and overlapping this weekend.
Absolutely. And we thank LBBC for having and hosting this platform just for these types of connections, for sure. Just as on one of our next to last topics, I do want to shift a little bit to talking about, again, you both talked about this a little bit, but kind of self-care as a means of support, what it looks like for you in terms of your emotional and mental outlook, kind of what may have changed since your diagnosis, what might have stayed the same, some kind of practices or things that you've done, what may have shifted or been more important for you. So in terms of self-care. So either one of you can answer.
Okay. Before my metastatic diagnosis, I was always in go mode. I never took time for myself. I was always working, 10 to 12 hours a day, come home, and I was working at home. Um, if I did have time off, it was on the weekends. And I was always drained. You find yourself just thinking wild all the time. You know, my mind's always active. But once I got my metastatic diagnosis and I started going to the cancer center, one of the holistic doctors was like, you need to take time for yourself. You've got to take care of yourself. And I'm like, I do. I take my medicine like I'm supposed to. I go to my doctor's appointments, and I got to thinking, what is it that I need to do? So now I make time for myself, and I stop and do things that I want to do. I go for massages. I make sure that I go get mani-pedis on a regular. Um, just to de-stress, just to have that unwinding time so that I can just sit down and quiet and just not have to hear anything that's going on, not to talk to friends with them venting about their day at work, and I listen sometimes, but sometimes, that just kind of overwhelms you, and I just need to have my space. And so I make time for me now just to do things that I enjoy.
Absolutely. A little pampering goes a long way. And I'm glad you mentioned massage, mani-pedis, and quiet time.
Hmm.
Absolutely. Jenny?
I would add yes, yes, and yes, all of those. I also have incorporated, well, from the very beginning, from 2012, acupuncture, I find very helpful. And I do manual lymph drainage massage because I have some mild lymphedema on my right side after my reconstructive surgery. So I find those very helpful. And yes, I've started dancing again. I used to dance as a kid, and now I'm dancing again. So that's really lovely. And then I also love to read. So it's really fun to sit down and read and to have the time to do that. Yeah, and one of the things I realized, one of the things I realized was in HER2, and in HER2 has this like range of possibilities for your hair. Some women have lost their hair. Some people have not, some women have not had any effect on their hair, and some people have had really thinning hair. So I'm in the sort of thinning category. So I realized that really that sort of outward look was really important to me. And yes, maybe it's my vanity, but it was also like I wasn't feeling good because I was dealing with my hair that was thinning. So I had to make a very conscious choice to cut it short, to make, again, feel like something, I had some semblance of control, very small upon, this chaos that is my life. And that felt really good. Like just going to the salon and getting my hair cut. Like, even though it's in the state that, that it's super thin and may even get thinner, like that I could do that. So yeah, it's the small things.
Absolutely. Go ahead, Stephanie.
Sure, thank you. Just before we move too far past, because this topic, because I think it also has to do with self-care, and maybe Celeste, this is one that you could take, and then Natasha and Jenny, if you have anything else to add, of course, we would love to hear from you. So what about for somebody who is experiencing depression and anxiety and sleep difficulty that doesn't feel like it's responding as well as hoped to kind of self-care or some other approaches? Is there anything you would recommend, Celeste, starting with you?
Sure. So I think speaking to your treatment team is very important. Sometimes, depending on your cancer center, there can be embedded psychosocial professionals, including psychiatrists, certified nurse practitioners, sometimes even oncologists may suggest a short course of medication to assist, and along with maybe a licensed clinical social worker, a licensed professional counselor, a marriage and family therapist, psychologist, may also couple that with some, therapeutic support, supportive counseling, which can be either virtual or in person. Those types of strategies and some of those, again, things are embedded within your cancer center. So please speak to your team about that. If you're not able to find it within your team, the next way that you can try to look for it, speak to, if there is a social worker, they may be able to work with you to find a network provider within your insurance network. Sometimes there's other professional organizations that may have search engines or ways that you can try to identify supports in the community or providers that can help you in that type of way. For sure, I would say start with your care team first, though.
Great, thank you so much. Thanks.
I don't know if either Natasha or Jenny wants to add to that, or that's good. Okay. All right. So we're coming up almost on our time. And so what I wanted to do is to kind of make sure that each of you has a little time to respond to this as we close out our session. And again, thank you so much for being vulnerable, open, present, and sharing your story, which can help so many people who are going to watch this and really kind of empower them and learn and feel related to you. So thank you again so much. And thank you to LBBC for hosting this. So what is one thing that each of you wished you knew when you were first diagnosed that you would want others to know? And I'm going to start with you, Natasha, and then we'll go to Jane.
From my experience, when I was first diagnosed, I would say just stop and take time to breathe and just know that you have time to make a decision. You don't have to make a decision in a day. Give yourself the opportunity to process things before you move forward.
Mm-hmm. Excellent. Thank you.
I guess one thing, I think it's two things. First off, if you're feeling pain, like if you're feeling something in your body and they want to tell you it's sciatica, or that you have had all these tests and there's nothing there, and something isn't feeling right, then continue to pursue that, and either with your oncology team or maybe somebody else who's listening. So I think part of my is that that's part of it, is that your body the best and the wisdom of it, and so really be attuned to that. And then yes, I would echo Natasha in terms of you do have time, and yes, breathing into all of the emotions we articulated is really helpful. And finding ways that serve you and your body in order to move through it. And sorry, I guess the other thing is that if you don't have an oncology team that you love, that's also a relationship that can be shifted. Just because you had, in my case, I stayed with the same oncology team, but if you had an early diagnosis and now you're back and they're not serving you in the ways you want, like, that's okay. There are more oncologists out there who are expert at their jobs.
Absolutely. You took the words out of my mouth. And to kind of piggyback on that, seeking a second opinion is not a betrayal of your care team. You don't have to worry about your doctor's feelings. And if you do, that might be a signal that's not necessarily the best team, because they are professionals. That is part of the practice of medicine, and that second opinions, third opinions certainly are something that you have a right to as a patient. And I also want to speak to even for folks who may be in more rural areas or maybe don't have as many cancer centers, there are different specialists in particular subtypes that sometimes will do second consultations via telehealth, and can partner with your local oncologist if there's a particular clinical trial or there's some other type of treatment or specialty or something they know about specifically for that case. So please don't be, afraid to seek that out. You are your biggest advocate, and this is your care. And that is important for you to feel comfortable in with your care team. And if you have to switch, switch. Absolutely. Do we have any final questions from our participants? Stephanie?
We do have one final question. I think we just have a couple minutes for this one before we wrap up. I do just want to thank all of you for that kind of advice that you just gave. There's a lot of wisdom and experience and openness from all three of you. So thank you for those really important pieces that you conveyed to the audience. This audience member asked, what do you recommend about doing your own research? I find myself wanting to know more, to advocate for myself, but I get so overwhelmed and emotional when I start researching. So if we could just maybe Natasha and Jenny each take a moment or two to give some thoughts there. Maybe start with you, Jenny.
Oh, sorry. Well, the internet, it can be a blessing and a curse, right? So when you get into the internet there and you may or may not know what you're looking for, sometimes the internet proves your thesis. So if you're going in sort of fatalistic, it will prove you correct. So my suggestion, I guess, is I like to have my information curated and then go figure it out from there. Like, hear from what my oncologist has to say first and my second opinion, and then use that language to then do my research as opposed to the other way around. But then, you get better at it. It is an art and a skill to be able to research, clinical trials, to be able to research ways in which people are talking about it. But LBBC is also a great resource for that too. They curate the information for you. So that there's a lot of resources on the website for that.
Thank you. How about you, Natasha?
I totally agree with Jenny. I learned a long time ago not to visit the internet. It will have you thinking the worst. So I always talk to my oncologist. And as Celeste said, after I got my metastatic diagnosis, I did seek a second opinion. So I travel out of state to a cancer treatment center for my treatments now. But I stay away from this internet. I always have questions for my oncology team, or I will reach out to someone who has been through something that's similar to what I'm going through if I have a question. But we have all of these tools on the computer. You can reach your doctor via chat, and I'll send a message. And if I don't get an answer, I'll send another message. It'll get to somebody on my care team, and somebody will get back to me and let me know what it is that I'm looking for.
Mm-hmm. Absolutely. Great advice. Great advice. And I think the other thing, there are some, including LBBC, there are some other, big name organizations that do curate some of these. American Cancer Society is one. Also, the accrediting bodies for these cancer centers and medical oncology. ASCO, American Society of Clinical Oncologists. They actually have a nice website, and they have both patient-friendly as well as professional information. The National Cancer Institute, NCI, has information as well. They even have search tools looking for clinical trials. Sometimes the language can be a bit much, but you can take that and take it to your care team. They do speak medicalese, which can be a challenge, but kind of breaking it down and asking folks to explain those terms and getting the answers that you need. Absolutely. Any final thoughts from either one of you to the audience that you want a message of hope or a message to them, those who are listening? Natasha, let's go with you.
Okay. Just continue to take one day at a time. And if you have questions, ask. If you don't know, if you don't ask, you'll never know. Just live life and treat every day as a new day, and find some joy in every day.
Great advice.
I'd say if you're here, if you're listening in today, then you are I don't know what to say, like ahead of the game. Like you are already taking care of yourself in a really, really important way. And yay. And so thank you. And thanks, Natasha and Celeste and Stephanie for, giving us this opportunity to be present with you and with each other.
Absolutely. And I will totally echo both of you. You've been here, you are here, you are enough. Your emotional experiences are okay. You are human. It is okay to have that. And as these lovely women have shared, you can move through them, accept them, and be who you are and live each day to make it the best day possible. And we thank you for sharing your stories.